Some persons go to hospital, they are treated, they come back home, they think they're fine, but they don't even know what they treated them for. Another case most people go through is that they treat and you're given medications, you never ask what medicine am I taking. If you then have to meet with another doctor, what will you tell the person that you have been taking? And how would that person be able to help you? In the first episode, I mentioned about James. Now, he had met with the doctor. He brought out the medications and said, this is what I've been taking. And the doctor's like, wow, please tell me you have not been taking this. And I said, "No, have been?" And I said, no, you shouldn't be taking this. Why? Because you don't have a heart problem. Taking these will cause a heart illness for you. And that is exactly what most people go through. They take medications without asking, what is this that I am taking? It is your duty, it is your right to know what you are taking. So you should ask the doctor, please, what are these drugs? What is the name? Why am I asking? I want to know what I am taking. And if for any reason I have to see another person or an emergency, I can say, well, I'm on this drug, I'm on this drug, and I'm on this drug. I've been treated for this, I've been treated for that. But most people don't even know what they've been treated for. They should have this information. What am I treated for? What am I being given? Why am I taking a stand? Or what am I doing with the test? If somebody recommends a test, tell the person, please, okay, what is this test about? What is it supposed to help find? Yes, it's important that you're getting educated as you're moving on the journey. Why? It will help you know exactly how to relate with more doctors. If you have the opportunity, for instance, you travel out of this country, you meet another doctor, what will you say is your history? Okay, what will you tell the person you've been treating for? Okay, what will you tell the person you've been taking? So if you don't know, you cannot actually even aid the conversation with the next doctor you're meeting. And there could be other cases where you're even not out of the country, you're just transferred, or maybe you traveled and you're spending 1 month there and you have some health challenge, you go to another hospital, they don't have your files, they don't have anything. It is what you know about your health that will help the doctor know exactly where to begin from. And that is why you need this information. This is key, this is important, and I want you to please give it attention. Let's talk. They thought her kidney was failing, but it wasn't. Now, let me ask you a question. If something went wrong inside your body right now, how confident are you that the last doctor you saw could have caught it? Now, I'm not talking about general kind of confidence. Now, I'm dealing with real confidence, real specific ones. Okay, why is this important? A wrong diagnosis doesn't just delay your treatment. Actually, it starts one. And I want to help you understand this. And the story I'm about to share with you will help you understand how to navigate the healthcare system more effectively. I'm talking about a story where 3 doctors examined a patient's results and only one got it right. Let's go down to the story of Mary. Mary is someone who never ignores her body. Now, she pays attention to her health and shows up early at the hospital when need be. She has treated ulcer a couple of times, and at this time, she had this pain that was different from what she's ever experienced, but much more worse. She felt a deep stomach pain, a pain that extended to her back and kept coming back and wasn't responding to treatment. She went straight up to an hospital and she met a general doctor who recommended her to do an echo scan and an x-ray. Now, while the echo scan was being carried out, the technician noted something and said, well, I think I see some fluid around your kidney area. And that was it. And she left that room waiting to see the doctor, but very, very now curious and worried. There was an issue or comment around her kidney. All right, so the doctor examined her case and then said to her, I know what to do. And he wrote and prescribed some medications for ulcer and gave it to her. But she was worried because there was being a mention about kidney and he was prescribing an ulcer medication. So the first thought that came was, let me get somebody else to do a review on this. And that is important. I talked about it in our last class. You can watch that video to help you understand what I'm saying. Now, when you get a complicated result, you want to have a second review. You want somebody else to review it so that you're not just running with something that you don't know. Now, she sent this result to a consultant who was a gynecologist. And then he requested for some other extra deeper test. I mentioned that in our last video. Now, when this test was done, it was sent back to him and he looked at it and said, wow, you need to go to the hospital right now. He said, what is wrong? He said, I can see there's a huge challenge on your kidney. You need to go to the nearest hospital right now, show them the result, and they will figure out what next to do. He said, I cannot give you or recommend any treatments right now for you to do at home because this is critical and you might need to be under the supervision of a doctor at the hospital. All right, so now she became hypertensed. and worried. Seriously, everything about her body and system began to fall apart. Why? Now you're dealing with a kidney. Come on. And she was dealing with other kinds of challenge before then. So what happened was, while this whole thing was coming and coming around her, she decided to say, okay, can I see another doctor? Let me just get another opinion on this matter. And luckily, she was able to find a very experienced cardiologist whom she sent all the materials to and said, this is what I saw. And the man looked at the document in 2 minutes, came to a conclusion, kidney was fine. Two, she had no ulcer, and all she was going through was caused by an infection. Wow. So no kidney, no ulcer, just infection. Now, she had to go back to complete a particular test that was coming out 3 days after. And when it came out, they still didn't change the verdict. She didn't have kidney challenge whatsoever. She didn't have ulcer. She only had infection. And in hearing that alone, she was 30% well before she took the first medication. And when she got that medication and started taking it in 2 days, all the symptoms were gone, all the pains were all gone, just because she met with the right doctor. Now, I cannot just over say this at all. This is important. Why? Because as soon as she had that result, that she had kidney challenge, she got terribly worse and conditions began to deteriorate. Why? It was not because her kidney was failing, but because she had information and she believed that her kidney was failing. It is psychological. Now, but after she had the news that it was not a kidney, that her kidney was fine, that it was just an infection, she felt better overnight without taking a first tablet. Why is this important? Any information that you get, especially on your health, has a very, very strong implication on you. There's a series where we're going to be talking about how doctors should communicate critical news to patients. And I want you to look out for it. But I want you to get the message in this session today. What changed everything for her was the fact that she did not settle with one doctor's opinion. She went further to figure out how to connect with the next person who could help her. Now, let me take you through something critical. The first doctor was a general doctor, trained to look at things from the surface, and he could not detect anything deeper, even when the results were in front of him. So, you need to understand that a general doctor may not be able to handle deeper level of challenge, and you must then require that you meet with a consultant. But then, what kind of consultant? It's not enough to see a consultant. It's important to be seeing the right consultant. The second person who looked at that documents, at a result, was a gynecologist, fantastic gynecologist, but not trained for that kind of challenge. And he was wise enough to also say, go see a doctor, go to the hospital, show them the result. They'll be able to direct you with which doctor you should be seeing. However, thankfully, she was able to connect with a consultant who looked into the whole thing and was able to detect within a few minutes what the problem was and never saw the inflammation in the way that the gynecologist saw it. Why? Because he was trained to see those things much more deeply and understand the science better. If you're taking something that had to do with reproductive challenge and all of that, to that cardiologist, you won't get the most out of it. Why? Because it's not trained for that. The gynecologist would have been able to give you a better result in that regard. So you cannot have one doctor for all kinds of ailment. No. And that is why when you go to the hospital, you must be willing to see the right doctor and be patient enough to go through that. Now, I want to share with you 5 things that you need to know before walking into the next medical visit that you have. But first, I want to invite you to subscribe to this channel, because the next video we're going to be releasing is going to be mind-blowing. It's going to help you understand things much more deeper. This series is going to open up some things to you and help you understand how the healthcare industry works and how to make the most of it. Some persons are having their health mismanaged because they don't understand these matters, and that is why we want to help you get it. So please click the subscribe button, turn on the notification bell so that anytime the video drops, you'll be the first to receive the notification and you can follow through, and it could save somebody around you. All right, so let's go back to our conversation. Welcome back. 5 things to know before your next medical visit. Very important. What is the first? Persistent pain not improving does not translate to repeat prescription. Okay, I was given a prescription the other time my stomach was paining me. Now I'm having the same pain. Let me go and find that particular drug and take it all over again. And then somehow you could just be repeating a medication that is not actually solving a problem that you have. So a persistent pain should translate to you seeing a doctor and then possibly doing a diagnosis. I always recommend that you get a diagnosis so that you understand deeply what is going on. That is number one. And that also means that try not to self-medicate. Let's say, I'm feeling the pain here, and just go to the pharmacies and say, please give me chest pain medication. And then you take it, and after some days, it comes back, you go back and say, give me chest pain. And now you keep doing that over and again. Your body is giving you a sign, but you are not listening. You are self-managing it. And you could be managing yourself to something more critical. So it might be that early detection might have solved the challenge before it gets to a state where you actually now depend on medication to live. All right, so let's go to the second. If a technician, while you're going through a scan or presents a test, mentions something about your health or any part of your organs, please, when you meet and sit before the doctor, ensure that it is brought up and that you have him address it. So in this case, for instance, when Mary went to the hospital, the doctor saw the result, ignored the other part that mentioned the kidney, whatever, and just went straight to giving her ulcer medication. If you're taking ulcer medication, it won't solve the problem. And the issue and the fear that she had will not even have been addressed. So it's important that you make sure that it is discussed and the doctor mentions it. If he does not mention it, you say, well, while the scan was going on or was being done, the technician mentioned something like this. And let him have a second look and give you a reason why you should not be worried about it or if it's something different. Number three, a referral is not failure. No, it's not failure of the doctor. Oh, the doctor is not good enough. No, it means that the doctor is choosing safety over convenience. It also means that the doctor understands its limits, knows what you need next, and is able to refer you to someone who can handle the case much more better. So a referral should not make you afraid. You should not be worried and say, why are they referring me? They are not referring you for anything else other than the fact that, okay, they figured out that the doctor who needs to see you is not within their area of coverage, and they need to send you to some place where you find a kind of doctor that handles your kind of challenge. Now, we're going to have a series that deals with why you see certain kinds of doctors. Some persons are actually having a very terrible lifestyle. I mean, they have been told to eat almost nothing they love just because of particular ailment. And the reason why that is happening is because they are seeing a wrong doctor who is generally limiting them under his own scope of understanding of the subject matter, whereas the right doctor will be able to guide you better. So you should not actually be suffering as much as you are for some persons, and that's because you're not seeing the right doctor. So we're going to take a series. So we'll look into some things like diabetes. We're going to look into some things, hypertension. We're going to look into some very, very important areas that people are actually dealing with, a lot of persons. So please stay tuned with this channel and look out for it. We're going to break some things down and show you which doctor you're supposed to be seeing. Some persons are going through some kind of challenge and they've never seen the kind of doctor or the right doctor that they should be seeing. It's important. And so number four, know your specialist. And that's what I've just been talking about. Know your specialist. Now, who I should be speaking with and why. It's important. And number five, uncertainty left untreated, it is own illness. Please always demand clarity. If you're not clear about anything, please ask. Some persons go to hospital, they are treated, they come back home, they think they're fine, but they don't even know what they treated them for. Now, if you by any chance meet or stands before another doctor, what will you tell him? What will you tell her? Okay, I went to the hospital. What did they treat? You have no idea. You don't have your history. You don't know what happened. You don't know exactly what you treated for. So how do you know what if they treated you rightly? Okay, so another case most people go through is that they treat that you're giving medications. You never ask what medicine am I taking. If you then have to meet with another doctor, what will you tell the person that you have been taking? And how would that person be able to help you? In the first episode, I mentioned about James. Now, he had met with the doctor. He brought out the medications and said, this is what I've been taking. And the doctor's like, wow, please tell me you have not been taking this. And I said, no, have been. And I said, no, you shouldn't be taking this. Why? Because you don't have a heart problem. Taking these will cause a heart illness for you. And that is exactly what most people go through. They take medications without asking, what is this that I am taking? Some hospitals might not even give it to you in terms of names of, they just give you drugs. But it is your duty, it is your right to know what you are taking. So you should ask the doctor, please, what are these drugs? What is the name? Why am I asking? I want to know what I am taking. And if for any reason I have to see another person or an emergency, I can say, well, I'm on this drug, I'm on this drug, and I'm on this drug. I've been treated for this, I've been treated for that. But most people don't even know what they've been treated for. And that is wrong. That is where clarity comes in. You need answers, you need information. You have the right to demand this information. The law permits for you to have it. And you should have this information. What am I treated for? What am I being given? Why am I taking a scan? Or what am I doing with the test? If somebody recommends a test, tell the person, please, okay, what is this test about? What is it supposed to help find? Yes, it's important that you're getting educated as you're moving on the journey. Why? It will help you know exactly how to relate with more doctors if you have the opportunity. For instance, you travel out of this country, you meet another doctor. What will you say is your history? Okay, what will you tell the person you've been treating for? Okay, what will you tell the person you've been taking? So if you don't know, you cannot actually even aid the conversation with the next doctor you're meeting. And there could be other cases where you're even not out of the country, you're just transferred, or maybe you traveled and you're spending 1 month there and you have some health challenge, you go to another hospital, they don't have your files, they don't have anything. It is what you know about your health that will help the doctor know exactly where to begin from. And that is why you need this information. This is key, this is important, and I want you to please give it attention. Now, Mary is completely fine. 2 days, and every diagnosis, every symptoms were gone. Why? Because she got the right diagnosis and the right medication. Please always win, always. And I want you to please take this to heart. Now, if this has been a help to you, I want you to do two things. Number one, I want you to subscribe to the channel. And number two, I want you to share this with somebody who is at the verge of dealing with something critical. Somebody around you, someone in your life is sitting right here with some pains. They have treated twice and even maybe more and keeps coming back. This video might just be the thing that sends them to the right door. And it's not just about finding the right door, but the right doctor and asking the right question. And that is what I'm going to be dealing with on the next episode. You don't want to miss it. And thank you once again for staying tuned. This is the Street Smart Healthcare Network, and I want you to stay glued to us. I'll be right back with another episode for you. See you again. Stay healthy.